Hi Professor, this side Tejwankar. I'll be talking about my reflective practice example. Critical thinking is asking the right questions to decide in any setting. It interprets the clinical situation by analyzing, evaluating, ruling out inference, explaining the inference, and self monitoring the results. One day I was posted in the ward, patient with dengue called me in the room to disconnect the fluid. I went and asked the reason, and he replied he wants to go to the toilet to urinate. Then I disconnected and came out immediately. After a while, his attendant informed me that he fell on the floor while trying to get up from the bed. So I rushed and aided him to stand and made him lie on the bed again. Fortunately, he didn't get hurt. I informed my colleagues and asked my consultant about the reason for the falling of the patient. Physician told me that in dengue people are dehydrated, so standing up so quickly would result in postal hypotension, which means low blood pressure when one stands up from the lying position. So I did some critical thinking by asking myself questions about the situation and asked the patient, "Did you get it fast?" He said yes. The yes answer from the patient gave me an analysis and an inference of the situation by providing me a valid cause of postal hypotension. I exercise clinical reasoning as well by opting the situation, by assessing the present situation and comparing it with the desired outcome, which is how we can help patients not to get hurt with falls from postal hypotension. The next step for me is to find solutions to what could I do to help them. I came up with options like assisting them while toileting, ask attendants to help them to assist, and ask them to sit for 4 to 5 minutes with legs hanging down the bed. Then, after evaluating every option, I felt the last option was the most efficient and discussed with my consultant for the permission to do that, and he agreed. Started asking every patient to do so. So I was getting good results after. I would tell every patient to sit for 5 minutes, then only stand up and perform any kind of activity. Nobody got hurt or felt dizziness. Clinical judgment is the process that involves cognitive process of noticing and responding to clinical situation with expertise and knowledge, which can be explained how I assume the above clinical situation, noticed it, and formulate solutions to it, and further made decisions with my knowledge about postal hypertension and how we can not let it happen to any patient in dengue. This can be done by comparing the patient's present health to the desired health. In the future, also, I would tell every patient to wait for a few time to pursue any kind of activity. Thank you.